You wouldn't know it by looking at Gergana Fullerton today, but just last year, this young woman was in the battle of her life. Around Mother's Day, Gergana got very sick.
I started to get 103 fevers really consistently. I would get night sweats and I would shiver at night as well. I would call my doctor every couple of days begging for help, and they just didn't really know what to do.
Gergana finally went to the ER at Providence St. Vincent Medical Center, and that's where she got the news she'll never forget.
She was diagnosed with endocarditis, which is an infection of the heart valve.
Turned out this wasn't Gergana's first heart problem. As an infant, she had to have heart surgery that eventually made her more susceptible to future problems. And now, at the age of 28, she had learned one of her heart valves was failing.
I think the biggest shock was when they told me that my valve had to be replaced. I refused to really believe it for the first 2 days. It was a little scary at first.
So in patients who need valve replacement, usually the choices are a tissue valve, which is usually a human cadaver valve or an animal valve versus a mechanical valve. Mechanical valves will last a long time, decades and decades, maybe her entire lifetime.
As doctors explained to Gergana, cadaver and animal valves don't last nearly as long and will need to be replaced much sooner. But there was one more factor. Gergana wanted a family, and if she chose the longer-lasting mechanical valve, she'd need to be on blood thinner medication.
It's a much more risky pregnancy. Some of these blood thinners can pose issues in terms of increase the risk of congenital heart defects in the baby. In these cases, we have to think hard and carefully about the risk of pregnancy and how we can create a plan for them so that they can successfully get through a pregnancy despite their heart condition.
Gergana decided on the cadaver valve, and so far it's turned out to be a great choice. Just 3 months after the operation, she got married. A short time after that, she ran her first half marathon. And just 11 months after open heart surgery, she completed her first full marathon.
As soon as I could start running, I did cardio rehab, and that was a huge help. If they let me walk on an incline, I was walking as high as they'd let me go. If they let me run, I was running as much as I could.
I think it's really important for us to really understand a patient's life goals, because then I think we can help them hopefully make it possible within the realm of medical possibility.
I really want to give my children the best chance that they have. I'm ready to live life.
Visit the link on your screen to learn more about a women's heart wellness workshop this Saturday at Providence St. Vincent.